We are back on the podcast this week with Tameka Wade Brewington, and I love her. She's one of our board members, and so I'm excited to chat with her. But she also specializes in working professionals, which I think is so needed right now.
Yep. And well, if you're listening to the podcast, there's a good chance you're working. Or you know somebody working. So this is a conversation that I'm thinking we're all going to need to hear about.
Absolutely.
Welcome to Connections, the podcast from addiction professionals of North Carolina, where we explore addiction through the lens of policy and practice.
We're your hosts,
Sara Howe
and Morgan Coiner, and we're here to help you see how it all connects.
Today we have with us one of APNC's board members, as well as the founder of Real Talk Counseling in Charlotte, Tameka Wade Brewington. Welcome to the show.
Thank you. Thank you for having me.
We are excited to have you. We were talking off screen about how we could take this conversation in a million directions. So let's start off with, tell us a little bit about Real Talk and the services you provide in Charlotte.
Okay. So Real Talk Counseling is a group private practice where we specialize in doing individual counseling with mental health and substance abuse working professionals.
Nice. So about how many people do you serve annually?
We serve about 5,000 people annually.
With a staff of?
We have 4 clinicians and myself, and then we have 3 interns. And I'm currently rotating nurse practitioners in because I'm thinking about adding nurse practitioners to the practice.
That's awesome.
Wow, that's incredible. And you said you serve working professionals.
Our niche is working professionals who deal with life transition issues. So we do see some people that are in college and things from that perspective. Mm-hmm. But I would say that our demographic would probably be about 26 to 45.
What brought you to that specific niche?
Well,
niche. I might have said it wrong, but we're going to keep going. Niche. Yeah. What brought you to that?
When I made the decision to open my private practice, I had been doing community mental health for about 20 years. Okay. And I was just going to continue and do that. But during that time frame in Charlotte, they said that the network was saturated with therapists. So they would not let me in to the community health arena. So then I had to decide, well, if I can't work with the people that I'm already serving, who would I like to serve? What would be a group of people that resonated with me? And so I like to do transitions and transformations and see the person go to the next level. And so then I said, okay, so if I'm not going to be doing community mental health doing next level, let's look at working professionals who are doing it. So,
I think that working professional piece is so important, because we spend so much time at our jobs, especially if you're like me, you work way too much. Yes. And I'm wondering what has that experience been like? What are you seeing?
What are today's working professionals struggling with?
Right.
Yeah.
I would say that there's like 3 different things that we see the most. The first thing is somebody who is, if it's a young working professional, they're coming out of the college space and they're trying to find their footing. They have this major, they think that they're going to have this great job, and they get in the job and then they don't like it. So now what am I supposed to do?
Common for all of us as we try to make our way in the world.
Right. And so then when you're looking at the older working professionals, they may have been working in their profession 5, 10, 15 years, and it's time to make a change. Am I going to go into upper management, or am I going to course correct and go in a different way? A lot of times when I'm working with the older working professionals, they'll be like, I've done everything that I'm supposed to do. I went to college, I got married, I got the kids, I got the good job, and I'm not happy. Mm-hmm. So now we have to take a look at, why are you not happy? What's going on? Yeah. And oftentimes it's because they're doing everything that somebody else has told them to do and not what they really want to do. So that's kind of like the transition and the exploration. And then you have some people who have interpersonal issues. Mm-hmm. I want to be married. I want to have kids. My biological clock is ticking, but I'm not dating anybody. How am I going to manage that if I don't get what I thought I was supposed to have at that age?
Mm. I feel like that's something we don't talk about a lot. Is there like the fantasy that we all picture for ourselves? Mm-hmm. And there is a professional fantasy for a lot of us of like, I want this job. I want to move through my career in this way. And it really can be jarring when that fantasy doesn't turn out how we thought it would.
Yeah. Yeah. It's difficult because people say, oh, I thought I would have been further along. I thought I would have done this. I thought I would have done that. And I'm just like, well, why did you think that? Who told you who told you had to be in upper management by 25? That's not a realistic expectation.
Right.
So, why do you think that you should already be in a leadership role or a management role and you're not even prepared? You don't even know what it looks like.
Right.
And you just told me that you don't even like your career. So why do we want to be a manager?
Double in on our mat. Right.
Yeah. And so it's a lot of really teasing out what's going on in your life and figuring out what the next step is going to be. With transition, people will think that, oh, if I get married, then everything is going to be okay. And so one of the things that I talk to people about is that your life doesn't stop when you reach a goal. It's ever evolving. It's not finite.
Yeah. It's an infinite mindset.
Yeah.
And things change.
Yes.
But a lot of things remain the same.
Yeah.
I get married and I still got the same junk I had before I was married.
Right.
I still got the same thoughts in my head. Right? Like I got a new job, but I'm still feeling this at home.
Right.
There's not just this one thing is going to fix it all.
Right.
Yeah.
Right. So I'm curious about the intersection of substance use. With working professionals, do you find many of them come to you with the SUD, or do you uncover it more when they come to you with mental health challenges and you uncover that SUD as you go down that path?
I would say it's both of them.
Okay.
I think it's both of them. I think sometimes they come, especially with anxiety, they'll come and they are coping with a substance. And it tracks because you have anxiety, but they don't know that they have anxiety. And they don't know that the reason why I'm utilizing marijuana is because I have anxiety and it helps me calm down and helps me focus and think from that perspective. Or if they have adult ADHD and was never diagnosed. And so they're coping with another substance until they get into counseling and figure out, oh, that's what's been going on. And then depending on the profession, you see a lot of alcohol use. And it's commonplace. Like if you're in corporate America and or if you're in sales, those are the two big ones that I see a lot where they have to go and take the clients out. So, long lunches and alcohol is involved. And then in the dinners, then alcohol is involved. And then it just becomes commonplace. And the more you drink, the higher your tolerance is.
Well, I mean, Sara and I have even been to dinners with various folks, not in this field necessarily, but sort of in our work. And I'm in recovery and they're like, red or white. Well, I would like a Diet Coke. And they're like, oh. Yeah, it's just like they didn't even think about it.
Right.
Because everybody's drinking.
Right.
Which has to be, I would imagine, if you're in recovery or early in your recovery, in a corporate landscape where alcohol is commonplace. I mean, we've talked to different companies where they have their own bar in the office, and on Fridays, Friday afternoon, that's what we do, right? And so, what does stigma look like in a corporate environment? What are we seeing?
It gives a lot of shame and a lot of embarrassment. I think that it's harder for them to admit that they need to stop drinking or using a substance if it's a cultural norm in the workplace, because they don't want to not be a part of.
You don't want to miss out.
Yeah.
There was I cannot remember the movie or the show, but there was I think it was actually Friends. It's a Friends episode where Rachel's not a smoker, but all the work gets done when they go take a smoke break. So she starts to smoke to normalize that and become part of that. And how relevant is that still today? Is that, do you think that's relevant?
Because one of the things when I have somebody that's coming in and they're saying, I think I may be drinking too much, or I don't like the relationship that I have with alcohol, the first thing I ask them is, what do you want your relationship to look like with alcohol?
Which that is a question people don't know how to answer.
Right.
Like we don't think about that.
And I would say 80 to 90% of the time, they don't want to stop drinking. And it really just depends if they've passed the threshold of whether or not they're going to be able to scale back. Right. And so then we have to educate and say, okay, let's look at your patterns. Let's look at what's going on. And then I always do, if they tell me they don't want to stop, then I always do harm reduction. And so I say, okay, can you do one less? Let's just do that for 2 weeks. If you're telling me that you're drinking 4 to 5 drinks 7 days a week, I need you to drink one less drink one night. Can you do that? And then let's report back and let's talk about it.
That's a great starting point.
Yeah.
So it takes a little bit of that fear of, well, if I go to treatment, they're going to make me abstinent, and then what am I going to do? And I'm not ready to change that relationship completely. You
can always tell where they are in the stages of change when I ask them that and what they say.
Oh.
Because if they say I still want to be able to drink socially, they're not ready to stop. So because they don't necessarily see it as that big of a problem, I can still manage it. I can handle the situation. It doesn't have control over me. And so it takes a little bit. It takes a couple of months for somebody to really say, hey, I'm probably going to have to do something different.
Gotcha. So we've started to do a lot of work recently on recovery-friendly workplaces and really building capacity in the business community, whether that's, Fortune 500 companies or the local restaurant owned by a family. So for those listeners, hopefully we have some business owners listening to this. What would we tell them about why it's important to help our employees to maintain a recovery-friendly workplace, recovery-friendly mindset? What does it do for an employer if we are addressing their mental health and potentially their substance use?
I think it's very important to take a look at how you're supporting the humanity of it. And so if I'm working for you, and let's say I've been working for you 4 or 5 years, and you enjoy the work that I do, and then I'm having an issue, the support needs to be there. I shouldn't be afraid that if I say, hey, I need to take a step back, I may need to go to treatment, or I need to look at something differently, am I going to get that support, or am I going to be in fear? One of the good things that I can say that a lot of corporate organizations have that have benefits, they have a benefit called EAP. EAP is Employee Assistance Programming, right? And basically what EAP is, it is an opportunity for you to connect with a counselor for free. Pretty much, I would say most EAP packages is 3 to 6 sessions. And so you get to meet with that therapist 3 to 6 times for free to see what's going on and to uncover what's going on for you. And a lot of people weren't really aware of this benefit.
People know that.
A lot of people don't necessarily know that that's part of their benefit package. But when it became really prevalent in my practice was during COVID. When everyone was in distress and they're at home and they're trying to teach their kids and they're trying to work from home and things from that perspective. And so a lot of people were tapping into resources, trying to find counselors and things from that perspective. So we saw a really big uptake with EAP services.
Well, in EAP, sometimes I know when I was young, my mom's EAP covered me.
It does. It covers the whole.
I was having a mental health crisis in high school. And my mom, luckily, she worked in insurance, so she knew all of this stuff.
Yeah.
But she was like, oh, like, I'm calling this number and you're going to start going to this thing. And I went, I had 8. That was a bougie plan. I don't know how she got that. But it was enough to get me stabilized so that we could then figure out sort of what the next step was. Am I going to continue counseling? Am I going to do medication? Am I going to do whatever? And I think that is almost even less known. It's like, oh, well, I'm the worker. Of course it covers me. But no, like my child is in distress. My husband is in distress. They actually can access this too.
Huge, important benefit.
Yes. Because when the family's in distress, the employee's in distress.
Right.
Like 100%. I don't come to work right if my family's not well.
Right. I think that's an important piece, though, to check your benefits, first of all, and find out what's available. Find out what's available for your family, your loved ones. I had a similar experience after my father passed away. He passed away in hospice, and they told me that Medicare covered 8 to 10 grief sessions for me and my sister. And I've said that to her. I'm like, if your loved one was in Medicare and hospice, there's something here. They were proactive, right? In reaching out and saying, did you know you can get grief therapy at no cost to you? And we have a specialist in grief on staff. I took advantage of it immediately. Absolutely. But whether it's mental health, substance use, work, all in benefits.
It's just funny because like my father also died in hospice and I did not get that same message. We had the same. This guy's very mixed. Like he was on Medicare, right? Like, and it's so these things are available.
Right.
But if we don't know about it, we need to take advantage of it. My concern too is if we don't know about it and we don't take advantage of it, then the message that is sent to our insurers is it's not necessary. We don't need to do it. We don't need to keep it. We can cut that benefit back. And a lot of it is really just arming ourselves with information because the insurance world is hard to navigate.
Hard to navigate.
Yeah, it really is.
I wonder, because there are some companies who will say, well, we have an EAP, we're done. But like, what are maybe one or two other things that an employer can do?
Great question.
To even make it so maybe I don't need to access that EAP because I'm feeling great at work. Like, what are some things that you would love to see employers do that would definitely benefit your clientele?
I would love to see the executives want to survey and get a pulse of the frontline staff. I think that I also do speaking engagements and workshops. And so I do wellness consultations for corporations.
Did you hear that, corporate America? Tameka's available for all corporate consultations.
It did. Some of the things that I see is that there's a disconnect from a generational perspective. And that's one of the things that we're seeing in media is that, you know, this generation versus this generation. But there is a disconnect in how we approach work. And the younger generations are very aware of their mental health and they're very aware of their stress and they're very aware of how they want to be treated in the workplace. And it is very different than the people who are in C-suite. C-suite wants you to come and do your job and they don't want to hear about your life. The frontline staff is a younger generation and they want to talk about their life. So they want to be seen. They want to be heard. And one of the things that I was doing a wellness workshop and I did an assessment and I did an assessment with the frontline staff, what they felt they needed. And then I did an assessment from the C-suite. And the dichotomy was so different. But when I was talking to the C-suite about the results, I was like, these are your kids. You taught them how to speak up and advocate for themselves. But now that they're in the workspace, you don't want them to speak up and we want you to just be quiet and do your job. And you can't do that. You really have to take the pulse because that's where you get high turnover and you get low productivity because they don't feel like they're being valued and appreciated the way that they want to be valued and appreciated.
I mean, there's so much data. Healthier workers. They increase that productivity. They save dollars and other costs, right? There's less on-the-job accidents depending on where you work. There's so many if we're just going financial economic benefits.
Right.
There are so many benefits to healthier workers and providing them the opportunity for their mental well-being.
Right. And if you show them that you buy into that and validating them, it makes the workplace so much more enjoyable.
Absolutely.
I think the other thing that generationally has been very interesting to me is the boundaries conversation. Sara and I talk about this a lot. For me, boundaries around work are a little more fluid. I am like, I work and I will tap out when my brain is done. Some days that's at 2 p.m. And I'm like, I can't anymore. But I might pick back up at 7 and work for another 2 hours and go to bed, right? Some people are like, I'm a strict done at 5. Don't talk to me. I will get back in touch with you at 9 a.m. And I think something that's been really helpful as I've learned to lead a team is like, you have to figure out what your boundaries are. I can give you some examples, but like, it doesn't have to just be a time. It doesn't just have to be a weekend. Like, our boundaries can be different. And one of those boundaries can be like, I'm not showing up my best today. And I think I need to go take a walk. That's a boundary.
Yeah.
And so I think there's a really interesting thing, though. Sara and I have talked a lot about it, of this, like, I'm done. This is the end of my workday. And I think that does work for some people, but I think it's much more fluid than that for most.
Right.
I think that prior to COVID, when everybody was in the workspace, people who are working in their passion and their job is not just a job, they don't necessarily, I'm done at 2:00.
Yep.
They don't see the clock.
Right. And so when prior to COVID, so if I'm just doing this job till me to end at 5:00, I'm done. You can't talk to me. You can't. They're very clear because now they're going to quote unquote enjoy their life.
Yep.
So then when you got the advent of COVID and being in your home, so now your work that you don't necessarily enjoy is in your home space. That's your sanctuary. It puts you into stress because now I don't know how to manage myself because the negative emotions is in my comfort zone. And so that was a lot of distress trying to figure out how am I going to create a boundary when work and house has merged. So that's the first thing that I started to see, that people had to find a different outlet. And unfortunately, during that time frame, that outlet was drinking.
So alcohol.
Yeah, it was drinking. It was happy hour on Zoom. The families would get together. Yeah,
Zoom happy hour.
happy hours and things from that perspective. And then we were locked down for a long time.
We really
so
were.
Just imagine how that 1 or 2 cocktails turns into 5 or 6. And it's not just happy hour one night a week. It's happy hour 3 or 4 nights a week.
Well, and then also the entire industry, right? Oh, now you can get alcohol from a restaurant to go. And now, right?
And the industry never went back. It stayed.
And now we're there, right?
Yep.
DoorDash, you can Uber alcohol. So
Yes.
right, DoorDash alcohol.
Have you seen, did you see a peak and then a taper back off? Or have you seen kind of drinking went up and it's really stayed there?
Drinking went up and it stayed there.
That sucks.
Yeah, because I don't see where that's an issue. It's just what I'm doing.
It's where I'm at now.
Yeah, it's just it's just a part of what I'm doing right now. One of the things that we're noticing in Charlotte, that we have the social drinking districts now, so that you can walk around with an open container in certain areas. And so the weather is breaking. The sun is out.
Yes.
And it was like when we got a warm day in Charlotte, that was it. It was people all over the place, walking around, and it's just to excess. It's just to excess.
Yeah.
So I know we're probably getting close to time, but for the business owners that are listening to this podcast, what might be some signs that their employee might benefit from EAP, might need a check-in on their wellness?
What I would say is if you have a strict timeline, like a 9 to 5, notice when they're getting in. Are they getting in later and later? Are they missing deadlines? What do they look like? Do they look tired? Do they look disheveled? Does it look like they're on edge? One of the things that I can say that I have noticed, that if a person contacts their human resource department, most often human resources will make a recommendation. And all of that is protected. And I wanted to make sure that I said that if you contact human resources and say, hey, I want to tap into this benefit, or I may need to take a leave of absence, that is not seen by your employer, the reasoning why you're taking that absence. Because I've had people come in and I'll say, well, you have EAP. Do you want to utilize your EAP benefits? And because somebody in that other company has already used it, and they'll say, no, because I don't want you telling.
I don't want them to know.
Yeah, I don't want my company to know. And I'm like, they don't know. This is your benefit. It has nothing to do with
They're not reporting back.
They're not going to see your notes. I'm not going to call them and say, you had a session and this is what we talked about, and things from that perspective. So oftentimes human resources, if you reach out and say, something's going on, I'm not really quite sure. Can you tell me, do we have EAP, or what does our insurance even cover mental health? Because we've seen that. I've had that happen where a client came in and she gave us her insurance and we tried to verify the insurance and they didn't have mental health benefits. And I was like, oh, wow.
That the fact that still exists in America is just hits me hard.
Yeah, I said, that can't be right.
Yeah, do not love that.
Yeah, I had the biller go and check, and they did not have mental health benefits. And so then when a person comes in, we don't turn anybody away. That's not who I am. I told you I came from community mental health. And now we're trying to figure it out, right? So we offer sliding scale, but there are organizations out there that help people who can't afford therapy. They can get it at a lower cost, or if their deductible is too high. Like if you have a $4,000 deductible and you're relatively healthy, you're going to be paying the full price out of pocket while you're in counseling. Right. And so there's organizations that we can refer to that they can get the services and still get it.
I think one other thing I want to mention. So we are live right now from Lake Junaluska at our spring conference, which means it's the end of April. And we are still left with a lot of questions about what federal funding is going to look like in this field. But across, I mean, we are not the only field with lots of federal funding.
Uncertainty.
I imagine we are seeing and will continue to see another spike in workplace mental health issues because the uncertainty of job security or the people who are running organizations that not only feel the weight of their job, but the weight of their staff's jobs. Like all of that, I think, is going to be so difficult for people to carry. And so I just think this conversation is so timely.
Very much so.
And I am grateful that we have someone like you in this state who is focusing specifically on this, because we are about to need you much more than we currently do.
Yeah. I have a concern. Like, I'm not concerned about counseling in general. Because people are getting ready to be in distress. We're already seeing more calls. My admin is saying the phone is like this. Like this. And the EAP referrals are coming in a lot faster. A lot faster. But if you lose your job, then you don't have benefits.
You have the benefits,
And if Medicaid funding is cut, and now you can't qualify to get Medicaid funding, then you can't get counseling from that. And that is the biggest concern that I have, is that how are people going to access care if they don't have the means or the ability to get it? You know, you can, there are some agencies that receive state funds, but if it's cut, then they're not going to be able to service everybody.
It's the perfect storm. Lose my commercial insurance, Medicaid gets cut or reduced. State funding that normally picks that up is no longer there. I mean, all the safety nets are starting to fail.
That's scary.
Right? That's and I don't want to end obviously this conversation on a panic button, but it's helpful for us to think about planning for the future, what this field looks like, because you're going to be needed. Obviously, workers need to work. They're the engine of our country, right? Our economics, but paying attention to their mental health is key to keeping them healthy, happy, productive. And if we can put a plug in, obviously, to our friends in Washington, we need to keep those benefits robust. Because we want to keep those workers working. So,
And we have the ability to support them. You know, that there are things we can do to make our employees feel safe, supported, healthy, happy, even in the midst of uncertainty. And so we appreciate you sharing some of those with us.
Thank you for being here today.
Of course.
We really appreciate the opportunity to hear more about this.
Tameka talked a lot about counseling people through transitions. And I think whether we're always transitioning somehow, whether it's a personal life, professional life, and it really drove home for me. Like, none of us love change. It's really hard for us. And so getting some tips for sort of how to work through that, but also seeing how she's supporting professionals through that is really cool.
And what really shined through is there's help, there's opportunities, there's ways to connect with people. You do not have to manage those transitions alone, and I think that's really important.